First, I want to say thank you for coming, and thank you to Brightbot.com for having me here to talk about lupus and living with chronic disease. My name is Julie Jo Kohler. I'm a lupus patient. I'm not a doctor, and for any medical advice, you should always consult your physician. During the presentation, your mics will be muted. They'll be unmuted at the end for questions and answers. You might want to keep a pen and paper nearby for any questions that you have during the presentation. And if you think of anything after that, you can actually go to brightbot.com. You can record a question, and you'll get an answer back recorded. That is very cool and helpful. So feel free to ask anything at the end. Today, I'm going to talk about managing your health care with a chronic condition like lupus. And let's get started.
Julie, can you make me co-host, please?
Sure. Okay, here we are, managing your healthcare. With a chronic condition, with lupus, with multiple specialists, managing your healthcare and self-management is a really important issue. Being your own advocate is utmost to getting the most results out of the healthcare that you have, with or without insurance, and especially without insurance. You have to be ready and on the ball. Chronic illness, I think the difference between a chronic illness and an acute illness is an injury is an acute illness. It's something that usually heals and doesn't come back. With chronic illness like lupus, you're going to have it your whole life. You're going to have to manage it every day. So you want to keep that in mind of how important it is. Do you take your health care seriously? You really have to take it seriously. If you don't, you'll never effectively manage it. There are ways to do that can help. One of those ways to self-manage is to work as a team with your doctor, your partners, your doctors. You want to keep what I call an overview of your condition, the medicines that you take, the name of the doctors, and their contacts. Everywhere. You want to print it out or write it out, and you want to keep it in your wallet or your purse 24/7. This is going to be your voice. With diseases like lupus, you experience fatigue, brain fog, low-grade fevers, and all those things can contribute to how much of a voice you have. So you want something like this in writing so that when you see one doctor, you can coordinate with your other doctors. They'll all be on the same page. It'll be easier for them to prescribe medications. It will be easier to not have interactions between medicines, and everyone will know what's going on. And that's up to you to take care of. Okay. Where does your healthcare need improvement? It's an important question. When you're self-managing your care, you need to figure out what's the problem. Are your meds working okay? Are you dieting and exercising, and maybe you need an adjustment in those meds? Are there procedures or treatments that can help you? Really important. I want to tell you a story. I went to see my general practitioner. I had a pinched nerve in my neck. I was bent over. I was in excruciating pain. They sent me for x-rays. When I came back, she said, I wish I could help you, but I don't know anything I can do. This can happen. And there are some doctors are familiar with some things and some aren't. And I was lucky enough to mention at my neurologist's office who I was seeing for something else. And he said, hey, I can give you a cortisone shot back there. At least that will help the pinched nerve right away. You want to always ask. Never assume that there's nothing that can help you. There are plenty of alternatives and natural treatments that other patients who have the same disease as you know that you can ask. So there are ways to make sure that you get the best care that you can. And then, are you following up? You always have to follow up. So your doctor will see how serious you are, reevaluate the medications that you're on, and work from there. And I'm going to get into a few specifics now. Okay. Prescription assistance. Is there anything you can do to afford your scripts? Yes. You have options. Sometimes you got to think outside the box, but there are lots of things that you can do. You can ask for a generic. Generics are always cheaper. You can ask for a 90-day script. Sometimes 90-day scripts at places like Walgreens and CVS are a lot cheaper than paying for 30 days. Mail order. A lot of insurance companies and even the local places have mail order now, and they want you to use it. So they offer an incentive, and sometimes those medications can be, whatever they are, can be found cheaper that way. 12-month refills. And I don't know if you have ever tried it, but I have. When you have a chronic condition, especially something like lupus, you are going to be on likely the same med all year. There's always a gold standard. You're going to need that med. And you can ask the doctor, can I have a 12-month prescription? So they give you the prescription with 11 refills. And that saves you a ton of money. It means you don't have to go back to the doctor if you can't afford it every month. It means at least you've got that basic taken care of. Pharmaceutical companies. I put up on the slide pparx.org because they have a database of all medications and the pharmaceutical companies that make them that offer financial assistance. So I don't know if any of you remember the commercial with Montel way back when he had a bus that went from city to city. That was them. They're still around. I believe they're a nonprofit, and it's a huge help. I have friends right now with lupus who get their medications this way. Sometimes your doctor will need to fill out some forms that the pharmaceutical company asks for, but it's a great resource. Cash discounts, always ask because you never know. Some of your doctors may charge a reasonable cost. If you don't have insurance, you need to see a rheumatologist, let's say once every 3 or 6 months. Ask about a cash discount. Office samples, a huge one. All the pharmaceutical companies that are carrying that little bag when they walk into the doctor's office, and you're always waiting for them to come and go, and they have pens with their names all over them. Well, they also have samples that they leave with the doctor. You can ask the doctor about the samples. Sometimes you might not know. Ask the office staff. They usually always know. I remember there was a time I didn't have insurance, and I'm diabetic and I needed insulin at the time. And I called up my endocrinologist and I said, is there any, help that you know of? He said, hey, I've got a ton of office samples sitting here in the refrigerator. And he took care of me for an entire year. So always ask. Never be afraid to ask. There are local venues you can go to, religious places, churches, synagogues, mosques, places like that offer help, where they may have a newsletter or an online place that you can type something into and mention. And then there's organizations for the disease you have, like for lupus. There's the Lupus Foundation, and they're really great about pointing you in the direction of local help that you can get, and at least doctors that they know treat lupus and have a lot of lupus patients that you can work with, and they can lead you to places like St. Vincent's and other local assistance, family assistance places that can help you with your costs. I want to talk about prioritizing. So sometimes you have to pick and choose when you don't have insurance, or when you have it and your medicines are way too expensive and your co-pays to see your specialists are way too expensive. When you can't pay for everything, you have to prioritize. You have to figure out how you're going to get by, which doctors you're going to see. The most important thing about this is to be honest. Don't leave your doctor's office with him thinking that you're going to go on $3,000 a month infusions when you're not and you can't, because he or she wants results for you too. To be a good doctor is to have a patient with results. So don't feel bad about asking. Always say something. That way you can work something out with the doctor. Sometimes a doctor can even write you a script for more than you need. And it's unconventional, but they do it to help patients. I've had it done for me, where instead of taking 4 a day, they'll write me a script for 8 a day, which gives me twice as many of my meds. So that helps me afford them. So you have to be honest. You have to prioritize your conditions too, the symptoms that you're having. In other words, if you have lupus and you have a rash, but you're having heart issues and you can't go to both specialists, you better go to the heart doctor first. So you have to prioritize who you're going to see. And that said, does your doctor listen to you? Working with your doctor is really important, especially if you're there and you don't have insurance, you won't be back for 3 to 6 months. You need to make the most of the appointment that you have. When you go in, give the doctor a short story of your symptoms. Instead of going in with lupus, you have multiple symptoms, and saying, I had a flare. That doesn't tell the doctor anything. Make it a story. I went out to the store. It was really sunny outside. I broke out in a rash. When I got home, I had a migraine, and I think it's starting a flare. So you're specific. This is going to sound funny, but break the mood. Your doctor might be busy. Your doctor might be having a bad day. This is the only time you're going to get with him. Kind of break the mood when he comes in. Give him a big smile. Make eye-to-eye contact and say, hey, I see you're really busy. it's really good to see you again, or something that will get his attention. 3 questions. Always remember to ask your doctor. 1, do my symptoms fit that diagnosis? If he says, gee, sounds like you might have rheumatoid arthritis with your lupus there, you want to ask, do my symptoms fit that? You want to ask, could it be something else? And then 3, you want to ask, could it be more than one issue? And the reason that you're doing that is that it could be more than one issue. It's not always lupus's fault. It could be just hypertension or diabetes that doesn't have anything to do with it. But you want your doctor to think along the lines of, what could it be? You want him to listen to what you're trying to say and what you're asking. You want to bring in that updated list with you. You want to bring in the overview. You want to make sure that he has the list of your medications and your other doctors. And if you are alone and you are advocating for yourself, you need to make sure that those other doctors get called. If they need to talk to each other, that's going to be on you. You can ask for help with the doctors, with the girls that work in the office. So, lots of times they'll help you in the front office, and they're really valuable. So you want to bring them in. And I can't say it enough. Bring someone. Bring someone to your appointment with you. Really, really important. You can't always, your voice isn't always strong, and you want your doctor to take you seriously, and you only have a certain amount of time because it's expensive. Bring a person with you. Your doctor will have to slow down and have to explain to the person now about your care, which gives you more time to figure out what the doctor is trying to tell you to do, and B, the person you brought with is now part of your team, so they can be there to help. And it's important that your doctor takes you seriously. So it's a good idea, your husband, wife, mother, sister, whoever you can drag in there, do bring somebody, especially when you're sick and you can't always stand up. I want to say, allow for uncertainty with your doctor. They don't always know. Sometimes patients can know before the doctor knows. And if a doctor refers you to somebody else, it's not terrible. It's good. So let them be unsure. Let them refer you for testing. So that's a good thing. And last, with your doctor, acknowledge your quirks. In other words, with lupus and having multiple symptoms in different organs of your body, it's easy to sound like a hypochondriac. It's easy. I mean, you walk in there and you know how doctors tell you, I really only want to hear about 3 things. Anything after that, you're going to have to make another appointment. Bring your list of what you want to talk about and tell him, sometimes, I sound like I'm always complaining with these issues. I know I have a lot of issues, but these are the ones that I really want to pay attention to and need your help with right now. And that way, when you're specific, he can help you specifically. Tips at the hospital and the ER. There's always the question, with or without insurance, if you're going to be admitted, you're not going to be admitted, what's going to get paid for, what's not going to get paid for. So you want to make sure that you're saving any way you can. Always find out if they are admitting you or they are keeping you for observation. There's a huge difference. If you have insurance, Some things aren't going to be covered if you're not admitted, and some are. So you want to know. You can always call at a hospital and ask for a patient advocate. They're there to help you. So don't be afraid to do that. The ER. Call your doctor first. I say this, I mean, if it's an extreme emergency, you're going to go to the ER. If you broke a leg, if you're having a heart attack, if you think you're having a stroke, just go. If it's lupus and it's a complication, it's a serious symptom, call your doctor first. There's emergency numbers. Use them. They work for you. Don't be afraid. That's what they're there for. There's answering services. Give them the message, because sometimes the doctor can call the hospital or the ER ahead of you. They can let them know you're coming. Some doctors, believe it or not, will even show up at the ER to help you, especially when you're a complicated patient. So don't be afraid to do that. Save money. Bring your own meds. Yeah, because if they give you meds, they're going to charge you for those. Bring your own pillow. Why not? Bring your toiletries, because you will be charged. So you kind of want to keep that in mind when you go to the hospital. So you can shop around. Prices are different, believe it or not, at different hospitals. Some are cheaper. Some are covered under your insurance and some aren't. You want to make sure that you're in, if you have insurance, you want to make sure you're in a covered hospital or urgent care center. Because if you're not, you're talking tons of money. And real quick, I just want to talk about health insurance questions. Know your health insurance. Know your copays, because you can't figure out what meds you're going to be able to afford and take if you don't know what they cost. Same thing with your visits. If you don't know what it's going to cost you to go to a specialist, find out. There's no other way to plan your care than to know what the prices are. If you need a referral, something you need to know. If you need a prior authorization for the medication that you want, that's something you also need to know. So be prepared, understand what your insurance is. If you don't, you can always call them. And most importantly, I want to talk about if you don't have insurance. And I love this cartoon because it says it all to me. I'm a doctor. Check his pocket for an insurance card. And that's, that's how it is when you don't have insurance. You're worried, are you going to be covered? Are you going to be taken care of? How much is it going to cost? What are your options? And I want to talk about thinking outside the box here. There are patient assistant programs like the PPARX and RX Assist that I talked about that have a database of the pharmaceutical companies that can help you financially with the medications that you need. And there is clinical trials, a really, really cool option. If, especially with lupus, there are always clinical trials going on. I put some of those websites up so that if you need to write them down, you can. And there are globally, if you're not in the US, centerwatch.org is the database for universal clinical trials. They keep track, I think, pretty much of everything. And our government trials are at clinicaltrials.gov. And I would say there are 24 ongoing open lupus clinical trials right now. And you got to figure that the first medication for lupus in 50 years was Benlysta a few years ago. It's given by infusion, and it started with the clinical trial. It's expensive, very expensive. It's over $3,000 a month if you're paying out of pocket. But some of these clinical trials and people that I know were able to get the medication through the trial. And through, I know GlaxoSmithKline has what's called a gateway program, and they offer lupus medication financial help. If you don't have any insurance at all, they have a program that will get you the Benlysta. So there's that kind of help out there, which is really cool. Online physicians, it's a new thing. I'm not totally familiar with it, but I know that you can pay some of these places to talk to a doctor, like versus Skype and other ways to be seen without a physical exam. So those are options. Patient groups, Facebook, Yahoo, Twitter, Tumblr, Google Plus, everywhere has groups. All you need to do is Google it. You'll find 100 different groups for lupus, a couple hundred different groups for rheumatoid arthritis. So chronic diseases have tons of groups. And one of the reasons they're so important and helpful is that patients know. If you're a patient, you know the medications. You're pretty informed, especially with something systemic like lupus, and asking advice and suggestions from someone else in your situation could save you a ton of money, a ton. Especially when, let's say you know you have lupus and you're having a horrible time with inflammation in your stomach, and you're nauseous, and what can you do? You can't afford to go to the doctor. Ask in one of these groups. I guarantee you'll get 10 answers on suggestions that can really, really help you, that don't cost you a lot of money. Places like Breakbot.com, very cool. First place I've ever seen. You can go record your question and get a recorded answer back. It doesn't take the place of a medical diagnosis or a physician, but it helps. It helps immensely. And when you don't have insurance and you're sick, it's a great place to go to get advice. So I strongly suggest that. It can lead you in the right direction. It can give you an alternative. It can give you a new idea on how to treat a symptom that you haven't heard of. It can save you money in the long run when you go to your appointments on how many you need to make. So I think it is doable with no insurance, and some people don't have a choice. I know there was a time I didn't and had to figure it out. I mean, there's the regulars, there's Medicare, Medicaid, Social Security, disability, all sorts of choices that you have, but without any insurance, this is what I would suggest. I'm going to go ahead and open up for questions and answers. Hang on. There we go.
Julie.
Yeah.
You had mentioned mail order, and I was just wondering, had you had any experience with, say, the Canadian pharmacies? Have you used them at all, and what was your experience?
I used them once, and I had a good experience. I was able to fax my prescription from my doctor to there, and I got a good price on it coming back. I've known other people who've done the same and who have gone to Canada for prescriptions, and they've all had really good results. So absolutely, you're right. That is an option.
Okay. And one other question, thank you. Patient advocates, right? Now I'm under the impression that they're being paid by the institution you're going to, right? At the hospital. So do you have any like example of how a patient advocate might be able to help you?
I had one personal experience when I was in the hospital for surgery with a patient advocate that I called. They came to my room. They asked me what my issues were. We went over them one at a time. I needed help to make sure that I had my right medications. Because at that time, you know, there's not always going to be a digital record at that hospital of everything that you take and what's wrong with you. So, and I was too sick to sit there and go on and on. So they came, they helped with that. They helped coordinate with my surgeon and my other doctors as far as what medicines they were putting me on and what to expect from the surgery. So they kind of got everybody together for me. I know that they help with situations in the hospital. If you feel like your pain isn't being addressed adequately, if you feel like the nurses aren't helping you when they should, if you're there and you're waiting for your doctor to release you for 2 days and you're ready to go, things like that, I know that they can help with. And they can talk with your insurance. They can make sure that they work with your insurance company so that they find out if you are covered.
Right. That was going to be my question, though. Do they help with any kind of billing or cost issues, that kind of thing?
Yeah, they do. Because they're there at the hospital and they're an advocate, they are supposed to be and usually are knowledgeable with all the insurances and what's covered and what's not.
Okay. Okay. Thank you.
Julie.
Yeah.
I know typically insurance companies prefer that you go to an urgent care before you go to the ER. With an illness like lupus, would that still be the same thing, or would they want you to go straight to the ER?
That's a really good question. I think that sometimes different insurance companies do it different ways. Mine, for example, doesn't require that I go to urgent care first. And I can just go to the ER if need be. But I think calling your doctor beforehand is really important because that way they can help for you to decide where you need to go. But you're saying some insurances require that you go to urgent care first, right? Yeah.
Right. Mm-hmm.
I haven't had insurance like that, but I can see that they would put plenty of stumbling blocks in the way of keeping you from the hospital the same way, you know, you've got all the step therapies with medications and tiers that you have to go through that are difficult. Yeah, that if with lupus, if they would have you go through the urgent care first, it really sounds like a wasted trip. But yeah, I would go. I would have my doctor call.
Okay. Thank you.
Yeah.
Is there a certain insurance company that people maybe find treat lupus a little better than other companies, or are they all pretty standard?
I would say they're all pretty standard. I don't know of anybody who is in love with their insurance company with lupus or has liked one over the other as far as that goes. I would say, though, that there are places like Banner and Mayo that have centers. That actually have lupus centers, and they have all the doctors working in the same place where you can see a neurologist there, you can see a rheumatologist, a nephrologist, and they coordinate your care that way. And if you have insurance that covers something like that, with lupus, that's a great idea. That's a really good idea. Very helpful. Any more questions?
Yeah, I have a couple questions. First one is, you were saying that there's a difference with respect to how the patient is charged by the insurance company if they're admitted or if they're classified as being on observation, or is that correct?
Yeah, right.
Okay, so is it, if a patient doesn't have health insurance, is it better, and they're paying out of pocket, is it therefore better to be on observation and for a patient to request not to be admitted? Is it going to be cheaper for them?
I think some hospitals, yes, and some no. I have not ever had consistent answers to that. I've called around and shopped, and I've asked if I'm admitted, how much is it going to cost me here? And it's like, well, about this much, depends what you're admitted for. And if they're just, have me under observation, they said usually under observation, the standard ER emergency costs are applied. And when you're admitted, all the new costs come in, like the bed, the pillow, the toiletries, all the extras. So yeah, you want to know what you are.
And you said that it would be a good idea to ask for a patient advocate, but that to me sounds like maybe not all hospitals have patient advocates. Maybe they have certain equivalents, but I guess number one, what rights do patients have if there is no patient advocate per se? Who could they ask to help them if there's no person who's a quote-unquote patient advocate?
That's a really good question. I would say call the front office or the back office, the accounting office maybe, of the hospital to ask for what costs are, if that could help you, or their corporate office for patient complaints maybe to help you. I think most big hospitals do have an advocate. They at least have somebody who's got the little cart who's going to come to your room and say, hey, do you have insurance? And maybe you can grab them and ask for help. With lupus, the Lupus Foundation is just one call away or an email away, and you can write them and say, hey, I'm in the hospital, and they don't know what they're doing, and I need help. I don't know if I can afford this, that, and the other. Who do I talk to? They might be able to help you. Other patients, asking other patients, people that you know who have been in that, who have been through that experience, I would think that they would have good stories to tell about different hospitals. And in a lot of these groups, you'll find someone from every city who's been to every hospital, and you'll find someone who's been there that you can ask. I wish I could have a better answer. But
is it a good idea to ask the floor supervisor, for instance? Would that, it seems to me that everybody should be a patient advocate. I mean, everybody has an obligation to the patient in some capacity. They should be advocating for the patient's health and the best quality. I think there are other questions, so so to answer my question, is this floor supervisor the person to ask for if there's no patient advocate per se?
sure, I would ask the floor supervisor. I would ask anybody and everybody for help if you need help. There's somebody there who can help you.
It looks like Tracy has a question.
Okay.
And actually, I just wanted to toss my 2 cents in on who you can ask. Every hospital has a social worker, and you can ask for the social worker to come to you, and it's the social worker's job to help with things like billing and financial issues and discharge planning and getting connected to, taking complaints, any issues you might have.
Oh, that's a great resource. That's fantastic. Yeah, absolutely. So you can just ask for the social worker, and it doesn't matter if you have insurance or you don't have insurance. Tracy?
And Sheila
Social
looks
worker
like,
is there for
Oh, sorry.
social worker is there for everybody. Every hospital has one, and yeah, it doesn't matter. It doesn't matter if you have insurance or not.
Good to know. Thank you.
thank you. I think Sheila had something to add also. Or not.
I can. You're talking about a website, breakbot.com?
Yeah,
Reakbot.
it's a Brightbot.
Brightbot.
Yeah,
Okay.
like shiny. BRIGHTBOD.
Brightbot. Okay. .com. Glad I asked.
Mm-hmm.
You must have excellent medical care because of the hundreds of times I've been in a hospital. Whenever I brought my own medication, they discharged, and I could never get my doctors to communicate with each other. It's like they all wanted to be the hero to cure me, and they didn't want anybody else's ideas. So I'm amazed at the care that you get.
Well, you got to stand up for yourself, even if you have to call that doctor and say, hey, so and so suggests that I take this. How do you feel about that? Let's figure it out. Stroke their ego a little bit and figure out what's best for you and make them feel like they're taking a big part in it. But ultimately, it's all about you. No doctor, no matter how good they are, is going to be better than you are at taking care of you.
Yeah, that's true. That's why I hate going to the hospital, because I don't have control over my own care anymore. And they usually do things that I've tried before and said I'm allergic to, but they insist that I take it anyway, and I won't, and then I get kicked out. So
Yeah.
I just
Yeah.
keep thinking, you must have really good hospital, really good care, because in 2 or 3 different states, I didn't have any of that.
Well, I think digital records are helping with situations like that, where a lot of times some of the bigger hospitals have your labs and your medications that you take that they can see at a glance. But that's the reason that I say call your doctor first. Call the emergency number, wake him up, get him out of bed, get him off the golf course, and say, hey, I have an emergency. I'm going to the ER and I need help, because they will listen to him or her.
They should.
Yeah,
Okay, thanks.
sure.
You mentioned something about the doctors limiting your visit. To me, it sounds like it's a little bit callous that if you're there and you're explaining what's going on, or you need advice or whatever it is, that they would actually impose like a time limit on your visit.
Oh, well, what some do with the insurance companies is they only allow for 3 concerns. In other words, if you go to the doctor's office with 4 things and you're about to tell them the 4th thing, they can stop you. I've had it done to me. They will tell you, make another appointment and come back in, because we are only and can only and are only covered to handle 3 things at a time. So you want to prioritize. You want to make more than 1 appointment if you have to. But yeah, they can stop you. I've been stopped. So, and it helps them too, because then they can kind of zero in on the most important issues if you minimize it down. I've had doctors leave and walk out early while I'm not done. Or, I mean, sometimes I've had them come in and out like they're on roller skates. and and it's hard, but that's why being prepared and having your list with you and all the little things like trying to capture his attention and bringing someone with you can really help.
Okay, thank you.
Sure. I'm going to say goodbye for now, and thank you all for coming. Remember, if you have any questions that you think of later, go ahead to brightbod.com. You can record your question, and you'll get a recorded answer back. Everybody have a great day.
Thank you. Good night.
Thank you. Good night.
Bye-bye.